Hi, I'm Jim Palmer, and I am Chief of the Division of Rhinology at the University of Pennsylvania in the Department of Otorhinolaryngology, Head and Neck Surgery. So chronic sinusitis, or chronic rhinosinusitis, which is probably its more appropriate definition, which is inflammation inside the nose and the sinuses. So it's not just the sinuses, it's the nose also. Affects, depending on who's making the list, about 19% of the population. So it is a very prevalent disease. Now, this disease does not need just surgery. A lot of people are treated appropriately with medications, irrigation of their nose with saline, or putting topical sprays and so on, antibiotics and steroids. But a big chunk of those patients will do better if they have surgery. Now, the surgeries prior to the mid-80s, early 90s were done by making incisions on the face and moving portions of the nose and the cheek out of the way and so forth. And obviously fairly brutal surgeries, and not many patients were interested in them. A major revolution in the field occurred at that time with the understanding if you used an endoscope, you could go into the sinuses and open up the drainage ports of the sinuses and relieve the obstruction. Probably not all that different than the revolution that took place in general surgery, moving to laparoscopic work for cholecystectomy and so on. One of the things that we noticed over the years doing sinus surgery and working on it and doing a lot of teaching courses and working with people was there really was no book out there that was a true surgical atlas. Almost all the books in rhinology were a paragraph type large chapter writing with a few pictures here and there, but it really wasn't the type of thing you could pick up, read, and immediately be able to do the procedure, or at least know how to do the procedure. So our goal in creating a comprehensive atlas of endoscopic sinus and skull-base surgery was to do exactly that. Create a surgical atlas that residents and attendings and all spectrum of the medical population could pick the book up, read a chapter, and have a good understanding in pictorial and written format how to do the procedure that they wanted to look at. The target market for this book is actually fairly large in terms of all otolaryngologists would fit under this. The majority of otolaryngologists do perform endoscopic sinus surgery, and so that target market goes all the way from residents and medical students beginning their careers all the way to those that are in practice now and have been in practice for years and would like to brush up and or begin to take on some of the larger, deeper surgeries that we have, especially with the endoscopic skull base work that's become so very popular recently. So for that, all spectrums of otolaryngologists can fit. Another group that we think will be interested in this book are radiologists, because they end up reading so many CT scans and MRIs from patients who have different aspects of sinonasal disease, and so many of them have been operated on. It's changed the way they look at things with the post-op pictures, and it's nice to be able to compare with an atlas to see how those procedures were actually performed. The group that wrote it are the cutting-edge surgeons in the entire world. This is not just a University of Pennsylvania book. This is not just a United States book. This is a global book, and we've been very fortunate that our authors have come from all corners of the globe, and they are on the cutting edge in each of the procedures that they wrote about. And it's also been really exciting to have one illustrator, Devin Stewart, who's worked with us, and so it creates a continual aspect through the book that each picture matches from other chapters. So instead of just each chapter standing on its own, which it can do, they all come together to create a comprehensive view of this exciting field. Well, Elsevier's been great, and to be honest, I've moved slower than I would like to with this book. This book has been in evolution for quite some period of time, and Elsevier's been fantastic and flexible and work with me and has given us great support in our ability to put this together. Obviously put together with a wonderful artist. We've had a fabulous editor that's helped us move things along, and they've been very flexible in allowing us to come and work on separate times to put the book together. And so to try and balance that with our career, it's always hard, especially as a surgeon, but you know, if you have projects that you care enough about, you're going to find time to get to them.
Great.